Grade 4 astrocytoma or glioblastoma is a type of tumor located in the brain. In 1926, Percival Bailey and Harvey Cushing discovered this cancer. It was based on the idea that the cancer develops from the precursors of the glial cells. In many cases, victims of glioblastoma do not even realize that they have cancer. How it usually starts is that they experience vomiting, sleepiness, visual impairment, weakness of one side of the body, seizures, swelling, personality change, difficulty speaking, nausea or headache. In some cases, the tumor can double in size in every 2 weeks. Some treatments for this type of cancer is radiosurgery, craniotomy, radiation therapy, and immunotherapy. In 2010, Stephanie Lipscomb, a freshman at the University of South Carolina Upstate, started to have headaches and was told that she had chronic migraines and was prescribed caffeine pills. They diagnosed her with other things as well, but she continued experiencing pain. It became so bad that she was rushed to an emergency room with a fear of meningitis. When her CT brain scans came back, they discovered a tumor the size of a tennis ball at the back of her right eye. It was the most aggressive form of brain cancer, glioblastoma. They decided to perform a surgery and remove it. Besides this, she had as much radiation and chemotherapy she could, but 2 years later it reappeared. Her doctor, Annick Desjardins, gave her the choice to do something that had never been tried on a human being before, an intentional treatment of the poliovirus. This method of killing cancer was new and had never been given to patients with cancer. All human cancers develop a shield that makes it undetectable to our immune system. By infecting the cancer with polio, you remove the shield and alert your system to attack the polio that is in the tumor. When your body attacks the polio, it finds out that there is actually a tumor and fights it. This current procedure was discovered by Dr. Matthias Gromeyer. Not only does the polio affect the tumor, but it also uses your own immune system to do most of the job. Just in 21 months, it was gone. The only thing that was left behind is a scar from a surgery. Unfortunately, more of something doesn't mean the better. Just recently, Donna Clegg, a patient with glioblastoma from Idaho, attempted her last resort to take the polio. The dose of polio was too much and her immune system reacted too strongly to it. The inflammation of the tumor put a great amount of pressure on her brain, and she became partly paralyzed. Later on, she dropped out of the trial because she decided that it was all too much, and then later on passed away. Doctors including Dr. Desjardins, Dr. Gromeyer, and many others are still trying to make a cure for glioblastoma possible, and one of them is a poliovirus. The poliovirus is working so far with positive results. May this be the new cure that will save 7.6 million people a year? Only time will tell.